Now, in an effort to save money, U.S. drug companies are using ingredients from China and other countries with lower labor costs. But after 81 deaths blamed on a contaminated ingredient in the blood thinner heparin, the Food and Drug Administration is being criticized for a lack of oversight. For more on this story, we are joined by former FDA Regulatory Counsel and founder of FDAimports.com, Ben England. He comes to us from Baltimore this morning. Ben, thanks for joining us on Morning Call here. Let me ask you, first of all, about the FDA's oversight. I mean, is the oversight of imported substances used by the FDA right now good enough?
I think the answer to that, by all accounts, is no, and even the FDA, I think, acknowledges that at this point. There's been a number of years where FDA has put very little resources into its foreign program and into its import program, in spite of changes in international trade and industries going to foreign markets for ingredients. And quite frankly, the FDA inspects a remarkably low percentage of imported product.
Now, why is that? I mean, we're reporting that that internal or staff at the FDA over the years have warned top management there to really start cracking down on this to protect customers from tainted drugs and ingredients from overseas. So why hasn't the FDA thought about this and moved on this earlier?
I think some of it is cost. It is difficult to regulate an international market. Some of it's, I think, bureaucratic inertia. The agency is much more comfortable managing a domestic market which they understand and they have access to. Some of it, I think, is just an unwillingness to, in the agency at the upper and upper management levels, to be willing to learn the realities of the market that they're required to regulate. There have been a number of situations where the agency was made aware of significant risks associated with imported ingredients, whether China or other countries, and the agency has just continued on status quo for far too long. What
are the things that the FDA needs to do, and what kind of costs really do you think are associated with this? It seems like if you have to look at every imported ingredient, it must get pretty expensive.
That's absolutely right, and nobody is advocating that. Nobody who actually understands the situation. It would make no sense to inspect everything. The question is, how does FDA figure out what it should or what it shouldn't inspect? How does it do the risk assessment? And at this point, the agency is just basically treating everything the same when it crosses the border, irrespective of the kinds of controls that many companies put in to their manufacturing and their supply chains to ensure that the product is safe and it's secure as it's transiting in international trade. So I think a lot of it has to do with resources, but if you just throw money at the FDA, you'll just end up with a bigger FDA, which I don't think anybody would be satisfied with. Yeah. The agency has to make some changes as the way it thinks about these kinds of risks.
Yeah, I mean, so what's the answer here? I mean, I was going to ask about the funding. Does the FDA need more funding here? The former FDA Commissioner Ronald Kessler said, quote, "There's no doubt we could have done more," and a group that he created to come up with a strategy on imported drugs was disbanded after he left. Do you think that there need to be more groups like that? Should they be rebanded, or what are the answers here?
Well, I think some of it has to do with the agency's own organizational structure. I mean, the agency is built to manage a domestic market. And there's so much inertia inside the agency to not shift to the realization of the international world, what they actually have to deal with, that some of it probably does require some restructuring inside the agency. So it's not just money, but the agency probably needs to have a significant portion of it that's focused on international and foreign aspects, and that probably needs to be directly funded through the budget. Right now, most of what FDA does in the field level or in the inspection level is coming through other budgetary mechanisms, and they don't have any direct funding. So it's not only money, it's also, I think, a kind of a reorganization, a reinvention of what the agency looks like.
I wonder if we're going to see that. Do you think that they're going to be able to make drugs imported from overseas safer? And I mean, what do you think the time frame is here?
Well, I mean, there's a lot of, the vast majority of drugs consumed in the country are manufactured either wholly or in part overseas, and has been for 20, 25 years. And we still have the safest drug supply in the world. So there is risk management, but the industry really is regulating itself and has been doing a pretty fine job of it. The problem is the agency doesn't have any oversight. As far as time frames, I mean, for the agency to really begin to have significant surveillance and to provide the kind of oversight that's necessary, we're talking probably 4 or 5 years.
All right. Hey, Ben, thanks so much for joining on this. Ben England, former FDA Regulatory Counsel, founder of FDAimports.com.